So let me quickly get my question in to Dr. Buchman and to Dr. Well, just to one of you, possibly. Would the collection of data based on race help in the treatment of the crisis?
I will just answer very quickly. The answer is absolutely yes. There is a disproportionate burden of the disease based on people's general status. Racism has contributed greatly to the disproportionate experience, say in the Black communities, in urban centers. That kind of thing is coming forward. We need to be able to get race-based data in order to be able to do the things we were talking about earlier, do the right contact tracing, protect these populations that are way more susceptible. Certain populations are doing more of the, are very much at risk. Healthcare workers, often women of color who are subjected to increased risk with lack of adequate PPE is an example. And so the bottom line is yes, absolutely yes.
Thank you.
Thank you, Sam.
Now, so if the question is about the virus and race, and we know from other jurisdictions that the virus is not blind to race. In the US, we know that the Black community has been severely impacted. We don't collect this data in Canada. So my question to you is anecdotally, because you face the customers, Dr. Power and Dr. Dattani, your members face the customers. Can you confirm whether this phenomena has been observed? And if we did collect data, how would it help your members?
That's a very good question, and you're right. It's difficult to speculate without data. So we don't have the data in Canada in terms of what demographics, what racial determinants, social determinants of health, how they impact the effects of this virus. But as you say, it doesn't appear to be blind to race, and we know the information from the US suggesting that the African American community doesn't do as well. I would not say this from my personal practice, but I think just from my anecdotal discussions with colleagues across the globe, what I have seen and heard from pharmacist colleagues in countries like Italy and countries like the UK, we've seen a tremendous impact on Italian communities, on even my own South Asian community in the UK. You could speculate that some of that could be due to the common, intergenerational families living together and the challenges that may be associated with that. But again, for me, that would just be speculation. There have also been healthcare providers that have been affected. So it's difficult to know unless you have that data what some of the racial or genotypic differences might be.
And if we had this data, how would it help? Would it help your members and across the country?
Well, I think it could help with a sense of understanding how to educate patients. I mean, there's even different ways that people metabolize drugs differently based on genotype and phenotype differences based on race. So it could help in some of those aspects as well. But yeah, unfortunately, we don't have the information.